I'm Katharine Barnard-Kelly and I'm a health psychologist working in diabetes and other chronic conditions. So I was thinking about burnout and burden on healthcare professionals. And I was reading in the news the other day that healthcare professionals are feeling as burdened, as under pressure now as they did at the height of the COVID pandemic during the lockdowns that we saw earlier this year and last year. So it kind of got me to thinking that it seems that the narrative has kind of shifted towards, well, COVID must be the problem. And certainly COVID is a problem. We see 36,000 new cases every day reported in the UK. We see excess deaths every day associated with COVID. And we know that hospital admissions, while they're coping currently, actually we're going into the flu season and respiratory diseases. So no wonder there's a lot of anxiety around what's going to happen over the next few months. But this has been going on for much longer than COVID. Healthcare professionals have felt burned out and stressed for much longer than the last 2 years. And if you look back to data from 2018, 2019, you can see that 53% of doctors, for example, in the States are experiencing significant levels of burnout and distress and pressure. And equally, 48% of nurses are equally experiencing unacceptable levels of burnout, of emotional distress. And this is nothing to do with COVID. This is pre-COVID times. So how is it that half of our healthcare professional workforce are experiencing such unpleasant symptoms of their job? And how is it that so many people are choosing to leave healthcare for reasons other than retirement because of these unprecedented levels of distress? And a lot is said about how we can support people in their self-management of chronic conditions. And obviously I work in diabetes a lot, and a lot of what we do is about supporting people with diabetes in improving quality of life, reducing burden, reducing distress associated with managing diabetes in the kind of broader lived experience context. But actually, I wonder if we should be putting equal efforts into supporting healthcare professionals more effectively so that they feel less burdened, less burned out in their role as supporting people with chronic conditions. Helping people in terms of routine care, for example, in terms of telemedicine, in terms of different ways to communicate effectively and to better understand their patients' needs and priority concerns. And that's a lot of what we're doing at Spotlight is, with our preclinical assessments and our platform to match and identify patient priority concerns to mapped care pathways, particularly psychological burden and social support, as well as medical self-management and kind of therapy issues, actually to help healthcare professionals in a much more effective way to reduce their burden, I think is equally important. And we talk a lot about parity of esteem between physical and mental well-being. Maybe we should be also thinking about parity of esteem between healthcare professional well-being and their patients' well-being, because only then are we going to be able to ensure that we have enough healthcare professionals working in healthcare to support the people with diabetes and other chronic conditions when they need it. Food for thought. Thank you.